Hi, welcome to a Children's Memorial Hermann Hospital's Facebook Live event. My name is Courtney Rupp. I'm the practice manager at the Fetal Center here at Children's Memorial Hermann Hospital. December is International Twin-to-Twin Transfusion Syndrome Awareness Month, otherwise known as TTTS. We're here with Dr. Ramesh Papana. He's a maternal specialist here at Children's Memorial Hermann Hospital, assistant professor of obstetrics and gynecology and reproductive Government Medical School at UT Health. Thanks for joining us today, Dr. Papana. He's here to help us answer some questions about twin-to-twin, the ins and outs of treatment, diagnosis, and all the options offered here at the Fetal Center. So without further ado, kind of hop into all of the different questions. Throughout this meeting, if you have any questions, feel free to type those into us. You have minutes with the expert, so take advantage of it, and here we go. Dr. Papana, tell us a little bit about TTTS and what it is and how common this condition is.
Well, first, thank you, Courtney. This is a wonderful opportunity to spread the message. I think we have made a significant progress in diagnosing and treating TTTS. I think there are many more patients that are not diagnosed or unaware of the disease. So just to tell you about Transfusion syndrome, it occurs in those who have identical twins with a shared placenta. That's the most important thing, identical twins with a shared placenta. In that kind of twins, 1 in 10 can end up having a complicated condition called twin-to-twin transfusion syndrome. Now, in overall, it occurs in 1 in 250 pregnancies. So in twins, identical twins is 1 in 10. Now, it seems rare, but it's the diagnosis without treatment, the prognosis is pretty abysmal.
Absolutely. So, what would a patient who has been diagnosed with twin-to-twin experience at their initial visit to the Fetal Center clinic? Actually, I can talk a little bit about that as the practice manager. When a mom is referred into us, they are initially contacted by one of our dedicated nurse coordinators who contacts them, walks through the disease process, what to expect. Many of our moms travel from great distances to come here for treatment, so we have an entire team that helps to coordinate that and to help these mothers feel supported. They don't have many people to reach out to that could gone through something like this, so that's where we're here for that. So, but then once they arrive and they get here for their ultrasound and evaluation, you can kind of talk about what you talk to the patients about during that evaluation process.
Well, thank you, Courtney. So, I want to take one step back. Is when you have twins, the most important thing that you need to ask your doctor is how many placentas do you have?
Absolutely.
And that is your first point, because missing that can miss the TTTS diagnosis, or it could be too late. So the most important thing is when you are diagnosed with twins very early in your pregnancy, ask how many placentas do you have. If it's 2 babies, you are at high risk of developing twin-to-twin transfusion syndrome. If you have 2 placentas, you're safe. You do not have a risk for developing TTTS. That's the first step. Then coming to the question of, once your doctors have followed you and identify our twin-to-twin transfusion syndrome, what do we do when you come to see us? We understand that this is a major change in your plan of a pregnancy. First, you diagnose a pregnancy, you're happy, and you got heard that you got twins. Then you're going through the emotions. Then you hit a truck.
Yes.
By a truck, that you got a diagnosis of twin-to-twin transfusion syndrome. So when you come to us, our goal is to educate you or understand what is going on. That is our very first step, and then explain as what we see to you and your family, and take time to make sure that you understood what's going on, and then only we talk about what to do next. So we take it as a step-by-step approach, and we have amazing supporting staff who understanding what's going on. So we as a team, we work together, make sure we progress you through the clinic for you to focus on what's going on to you and your babies, than trying to understand it, worry about anything else to navigate medical center. So when you come here, we walk you through step by step. First, a high-risk ultrasound, looking at what's going on with the babies, are they anatomically normal or not. Then we do a comprehensive ultrasound with the heart to see heart function. And then we also find out, is there any differences in your presentation of how the twins are located, how the placenta is situated, and then we decide what options we have. So we walk you through step by step. And it's approximately takes 4 to 5 hours of evaluation and counseling. Once we know that what you need to do, then we will plan for the next part of the treatment.
Absolutely, absolutely. One thing I know that you do cover during the evaluation process are the 5 stages of twin-to-twin transfusion syndrome. Can you take a moment to walk us through what those 5 stages are when we offer treatment, when we do intervention?
So typically when a physician is referred you with a diagnosis, they are looking at a fluid discordance in the babies. They're supposed to be equal in both babies, so the membrane between them freely floating. So if we start to see one baby has a less fluid, another one has too much fluid, that's when doctors usually refer you to us. Sometimes they have a complete evaluation, sometimes may not be a complete evaluation. So when we come here, we do a thorough assessment to make a what we call Quintero staging. There are 5 stages. And the stage 1 is where there is only a fluid difference between the two, and it has to meet a certain criteria. And the stage 2 is have a fluid difference along with a little one, and we do not see a bladder that is either very small or is not no urine in it. That's a stage 2. Stage 3 is when we have a blood flow abnormalities suggestive of a cardiac heart failure leading to a fluid accumulation under the skin. And then stage 5 is the end, which is it's a although we call it as stages, it's not necessarily they progress along 1, 2, 3, 4, 5, and there is no definitive time interval. A stage 3 can skip and become a stage 5 very quickly. So is some. So although these are the disease, it doesn't mean that stage 3 we have time for intervention. Sometimes stage 3 could be worse than a stage 4. So I just want to make sure I bring that out.
One question a mom has asked is, can you prevent TTTS?
That's an excellent question. Unfortunately, no. We know the reason why they develop twin-to-twin transfusion syndrome is because of the imbalance in the placental connections. So as I mentioned earlier, twin-to-twin transfusion syndrome occurs in identical twins with the shared placenta. In the shared placenta, there are connections of blood vessels between the two babies. So 9 out of 10 times the blood flow is equal. It's like a traffic going back and forth, and the end of the day is equal. In 1 in 10, the balance is not equal. The amount of blood flowing one way doesn't come back completely. That is a problem. Now, we do not know of anything that would prevent one developing from TTTS. There is some anecdotal reports of taking protein-rich diet might prevent twin-to-twin transfusion syndrome, but it's never been proven. However, diet itself is important in twins in general to prevent other medical problems. So taking a sufficient amount of protein, sufficient amount of iron is essential for twins in general, but there is nothing that we know of to prevent TTTS so far. Most important is to diagnose it on time. One thing you could, as a patient, take ownership of your health is sometimes the presentation of twin-to-twin transfusion syndrome is that they develop this sudden increase in the abdominal girth. Many times patients feel that this is because they're twins, they're growing quickly, that's why they feel that way. But it could be because the rapid accumulation of fluid in the big baby, and that makes you either cannot eat, sleep, or lie down flat. These all could be as signs or symptoms of TTTS. So if you have identical twins, the shared placenta, if you feel that way, check up with your doctor, find out what the fluids are, and then that could be the good start.
Absolutely. And I think another question that's come through, and I think you've addressed it, is really understanding chorionicity, and they do want to, one of the questions was, can TTTS not happen with fraternal twins? So I think if you wanted to address that and how that works.
Yes. Whenever there are fraternal twins, I just want to make sure I understand, explain to you very clearly. If they have a discordant sexes of the baby, one is boy, one is a girl, it cannot happen because when you have two different types of babies from two different eggs, that's what comes down to, two different eggs, two different sperm, and they have separate placentas. And they do not have a connections in the placenta, so therefore they should not develop TTTS. Again, identical twins can have a separate placentas and do not develop TTTS. It have to have a single placenta, two twins.
Perfect, perfect. Kind of going back to, we were talking about the staging of the disease. When is fetal treatment required? What is our laser ablation therapy that we offer here? But when do you, as a surgeon, want to go in and intervene to help?
Okay. So the treatment for TTTS is offered for anyone stage 2 to stage 4. Stage 5 is too late. Stage 1 we do offer in certain times. That is when the mother is extremely symptomatic from the polyhydramnios or what is increased amniotic fluid, or cervix is too short from the polyhydramnios. So those two conditions we offer treatment for stage 1. For treatment for stage 1 for anyone as a trial, it's a clinical trial undergoing where we are trying to find out whether treating the TTT stage 1 is it beneficial, because close to 40% of patients with stage 1 can resolve itself. We don't need to treat. So that's why we avoid treating unless it's necessary.
Absolutely, perfect. And is laser ablation therapy a high-risk procedure?
Okay, so before we jump to the treatment options of laser, I want to make sure we, what other options are there. These are all developed over decades. Very first treatment was to be what we call amnio reduction, where we put a needle in and then take the extra fluid out. And sometimes they made a hole between the membranes in order to equal the fluid. Now we don't do those as primary options anymore because the outcomes are pretty low in terms of survival, also a healthy survival. The next option is the laser surgery. This has become a standard ever since there was a trial that compared laser to repeat amniocentesis reduction, and the laser babies did much better. So therefore, it's become a standard of therapy. It is a high-risk procedure, mainly for the pregnancy outcomes are concerned. It requires a sophisticated surgical skills that needs to be trained to do that. Because the most important part of the laser surgery, the principle or the goal of laser surgery is to identify the placental connections between the babies and then use a laser energy to burn those connections. And we have to hit all the vessels. Cannot do half and leave the other half. So that makes it the procedure more difficult, or you need that expertise. And we do this procedure underwater, so which also adds an additional complexity. Therefore, it is a high-risk procedure, as that you may not complete the procedure, or if you leave the anastomosis, can have significant consequences.
Absolutely, absolutely. How does the multidisciplinary team here at Children's Memorial Hermann Hospital work to care for the patients? How do everyone comes together for these moms? And just if you can talk about that, the great team we have here.
So, yes, that's an important question. So the multidisciplinary team for this is we take all the disciplines to help the patient. We start with the ultrasound sonographers. These sonographers are especially skilled to assess transfusion syndrome. They are trained to do Dopplers in difficult situations to get a better assessment of the twins. Then of course the maternal fetal medicine specialists who would do the surgery. Then we have a fetal echocardiograph, or the cardiologist who will assess the heart health. Sometimes the disease may not look severe on the ultrasound, but on the heart health, when we do the echocardiogram, it might look more severe, and that would prompt us to treat sooner than or continue to observe. Then we also have a genetic counselors. We look at the fetal anomaly. If there are an associated anomalies, like not just the twin-to-twin transfusion syndrome, we see something else, then we have a genetic counselor kind of walk you through what are the possible reasons for it. When we do the laser, should we send the amniotic fluid for karyotype? And then if there is a heart anomaly, we have subspecialists who can come and talk about what would be for baby after, if it survives, and after birth, what could happen. If there is a brain defects or brain lesions that are there, then we have a subspecialist like a neurosurgeons, neurologists come and talk. So we take every different disciplines to help to optimize the care for the patient, and we do that all on the same day. And the subspecialists come to the place, so we don't need to necessarily patient go everywhere. They stay in one place, but the subspecialists come to that place with the fetal center and counsel the patient.
Absolutely. I think that's something that's really important to highlight, that we do use a multidisciplinary team that is patient-centered. It is all about the moms. When they're here for their evaluation, they are here for, it's probably the longest day of their life. And we do everything that we can to make sure that they feel supported throughout this time. So that's
one more thing I didn't mention is that in the twin-to-twin transfusion syndrome, as I mentioned to the laser surgeries to ablate those connections. Sometimes the placenta is in the anterior, which is on the what I would recommend tell the patients that is in the roof of the womb. It'll be hard to see, so we may have to do what we call laparoscopic approach, and we use our pediatric surgeon who are very trained and skilled to do laparoscopy pregnancy to enter the uterus from behind, and basically from flank of the mother and enter the uterus from behind and do the laser surgery. And we have, in the United States, we have done the most number of procedures that way in a difficult circumstances. So we use every resources that are possible to improve the outcome for the patients.
Absolutely, absolutely. One great question, I think, is do all patients qualify for the laser ablation procedure?
So we approach every patient open mind in terms of counseling. We start with do nothing to amnio reduction alone, and we also offer laser surgery, and then what we call selective reduction, which is where we intentionally stop the blood flow in one of the fetus in order to improve the outcome for the other one. These choices are sometimes difficult choices, and especially in the twins with the twin-to-twin transfusion syndrome, one baby has a severe anomaly, and this would give an option for a family to minimize the surgical complication by doing the selective reduction to optimize the outcome for the normal one. So that is also the other option, and we keep the option open for if the patient were to choose to end the pregnancy for various reasons. We discuss all the options as they go through the plan, and then we do what they choose at the end.
Absolutely, absolutely. Are there usually positive outcomes for an in utero procedure?
Absolutely. So if you go back 25 years ago, many of these pregnancies were either not diagnosed or they miscarried, and we didn't know what it is. And we have made a significant progress from that time to today.
Absolutely.
So if you don't do anything for generally in all twin-to-twin transfusion syndrome, 30% of the chance that you're going to take home a baby. We improve that to almost 70%. You're going to take home 2 babies, and only maybe another 10-15% take home only 1 baby, and approximately 10% of them take home no baby. So we have come from where we were. So that is the outcomes of a laser surgery.
Absolutely, absolutely. What does the Fetal Center do to ease the fears or concerns of the moms that have received this diagnosis that have been referred in? I'll say, I think it's a great question. One thing that we've kind of talked about is the multidisciplinary approach, but then also speaking from the staff perspective, the support staff here, we do everything possible to, again, make this entire family feel supported and to know that they have options and answers, and that they are seeing, the best team possible. And I know you as a physician, you can speak to that. What do you do to make sure the mom feels supported?
I think it's an excellent question. I think there's nothing more important than knowledge in that difficult circumstances. And knowledge not necessarily for the patient, for their family, because she takes the counseling from her family as what to do. So the very first step is our nurse coordinators get on with the phone directly with the patient. Talk about, give some information as what is going to happen in the next 2 days. This is a major change in their life, and we want to take a step at a time. And then we also provide online video educational link that is through our website, and that their patient can refer their family members to go and look at the video. That kind of gives them a place for knowledge. That knowledge is extremely valuable. By the time they come to us, many of them know most of the questions and what to expect, and their questions are more refined when we talk to them, which is both helpful for the patient because it empowers them to know what they need to know or what they want to know, and then they will be looking for more questions that are down the line. What's going to be my child of 2 years of age? What's going to be my child at 5 years of age? And what are the nuances or uniqueness of her, our patient, in her situation? How do we make it better? So that's what I feel that we do very well, is we reach out to the patient. It's a two-way approach, and we make sure, having done this for well over 900 patients in our lifetime, if we have a good understanding of what does a patient need. And one thing I can tell you for sure is every patient is different. And in spite of there is a variations that happens in surgically and patient, but they're coming from a different circumstances. Everybody has a different life experience. So we walk through their experience in a very open approach. We do not rush anybody to do something. We take time, counseling, and also this is an emergency. It's not that we have a month to decide. It all has to happen a matter of day, which is another a burden or a difficulty the patient is in. So we take time to unravel the problems in a slow fashion and then explain to them one by one and letting them to the decision. And then once they make the decision, we support them through the process and do the surgery, and we keep an open communication during the hospital stay, and even after they go home. Whatever the outcome is, they go home. We keep in touch all through their pregnancy. We counsel them, and if necessary, we get informed with their referring physician to see how to improve the outcomes. And then we continue to follow them after the children is born, and then basically we follow them all the way through. So we maintain this a long-term relation with our patients.
Yes. I'm really glad we're meeting with you today, because I think this next question you can really speak to. What is the Fetal Center doing to advance treatment options, new research developments in the treatment of twin-to-twin? Dr. Papana is really working to advance our entire research arm here at the Fetal Center. So if you can speak to some of the great things that we're doing here at McGovern Medical School and Children's Memorial Hermann.
Thank you, Courtney. Well, this is very close to my heart. We have done an amazing job improving the outcomes of these children. Survival. I think our next big challenge is how to improve their outcomes on a long term. One step begins is our preterm birth. On average, a pregnancy diagnosed with twin-to-twin transfusion syndrome underwent laser surgery delivers a month and a half to 2 months earlier than other twins. Now that puts a huge for us. That is improve the outcomes even further.
Absolutely. Yeah, huge thank you. The placenta, coming to the family reunion, talking to us, it makes such a difference, and it makes such an impact on how we can advance the treatment for twin-to-twin transfusion syndrome. So kind of wrapping up, I know that there are a lot of different centers in the United States Why should a patient come to the Fetal Center for treatment? What makes us different?
Well, I'm biased in this. I think all I can tell you is, we have an amazing team. We take the amazing team with experience,
Yeah.
and we are passionate to improve outcomes for every patient, and we have done some of the complex laser surgeries, including those who have failed laser surgeries before, and we have done experience in doing even twin-to-twin transfusions in triplet situations, and so that expertise and level of understanding, and we're done with all of us combined, we have probably done well over 900 cases. So that the wealth of knowledge is extremely helpful to optimize the outcome for every patient. And we are also an active place for research. It means we are constantly trying to improve ourselves, and that gives an edge to benefit our patients, in order to improve outcome for every time any next patient we see. We constantly modify to help things to improve. So that we feel that we are unique.
Absolutely. Well, thank you, Dr. Papana, for taking the time to speak with us today and giving out all this information. I know it is really helpful for everybody watching out there, really helpful in fighting against this disease that we, have worked so much to try to change. So thank you to everyone for watching our Facebook Live event with Memorial Hermann Hospital.